Now this trusted hemorrhage control technology is available for external use on arterial and venous puncture sites and is becoming a trusted solution for diagnostic and interventional procedures in catheterization, interventional radiology, and electrophysiology labs. The HemCon dressings are effective on high-pressure, high-flow arterial bleeds and will reduce the time to hemostasis, even for anticoagulated patients, freeing up medical staff and improving patient comfort. The dressings are easy to use and provide an antibacterial barrier that helps to reduce the patient's risk of infection. HemCon dressings become extremely adherent when in contact with blood. The adhesive-like action seals the wound and controls bleeding. HemCon products are fabricated from chitosan, a naturally occurring biocompatible polysaccharide. The unique manufacturing process of the chitosan dressings creates an adhesive nature and offers a positive charge that attracts red blood cells and platelets, which have a negative charge. As the red blood cells and platelets are drawn toward the bandage through this ionic interaction, a very strong clot and seal is formed at the dermal wound site. This supportive primary seal allows the body to effectively activate the coagulation pathway, initially forming organized platelets. The platelets and red blood cells travel up the access tract where they adhere and strengthen the initial primary seal. HemCon dressings are designed to maintain a strong seal and serve as a frontline support structure. The platelets and red blood cells will continue to aggregate until hemostasis and clotting are achieved. The sealing of the wound site acts as an antibacterial barrier against a wide spectrum of gram-positive and gram-negative bacterial microorganisms, including Staphylococcus aureus and Klebsiella pneumoniae. In a preclinical study using an 8 French sheath, the HemCon bandage achieved faster hemostasis and fewer hematomas than the gauze control group. The study concluded that the extent of hematoma formation was directly related to the length of time required to achieve hemostasis. To promote hemostasis using a HemCon bandage, open the sterile foil pouch and remove the bandage. Draw out the introductory sheath from the puncture site at an angle. Apply direct proximal pressure to the puncture site to control bleeding. Place a small amount of pressure on the skin surrounding the puncture site. Allow a small amount of blood, approximately the size of a nickel, to surround the puncture site. Do not cleanse the puncture site or moisten with saline solution. Blood is required to facilitate the unique adhesion process. With the printed tan-colored side facing up, place the HemCon bandage directly on the puncture site, extending over the entire vascular access tract. Once the bandage is applied, hold digital pressure across the entire vascular access tract for 5 minutes, or the amount of time specified in your institution's protocol. Release digital pressure. The bandage will have adhered only where the blood was present. After bleeding has stopped, secure the HemCon bandage with an appropriate dressing. Recheck the wound for potential rebleeding as necessary. The HemCon bandage can remain in place up to 48 hours. To loosen and remove the bandage, irrigate with sterile water or saline while gently pulling up on the corner of the bandage. Or instruct discharged patients to soak the bandage in the shower and then gently peel off the bandage.